My name is Michelle Bao. I'm a first-year pediatric gastroenterology and hepatology fellow at Mount Sinai Children's Hospital. I am here today to talk about hepatitis C in children, screening, diagnosis, and treatment. What is hepatitis C? The hepatitis C virus, or HCV, causes an infection which damages the liver. It is spread by coming into contact with blood from a person who is infected with the virus. In adults, this most commonly happens through sharing infected needles for drug use, though can also happen through getting tattoos and piercings with infected needles and through sexual intercourse with an infected person. Mothers who have HCV can spread the infection to their child during pregnancy or childbirth. For up to 45% of children who get HCV, their bodies are able to clear the infection on their own by age 2 without needing treatment. However, children who don't clear the infection go on to develop long-term infection known as chronic HCV. Why is chronic HCV a problem? People with chronic HCV often do not have symptoms of infection until there has been significant damage in the liver. Because of this, many people with HCV don't know that they have the infection. Over time, if left untreated, chronic HCV can lead to liver inflammation, liver scarring, and even cancer. It is a leading cause of liver transplantation in the U.S. How fast the liver damage occurs and how serious it becomes varies from person to person. Children usually do not develop significant liver damage during childhood. However, though uncommon, they can be sick enough to need liver transplantation. How do we diagnose chronic HCV? Chronic HCV is diagnosed using blood tests. The first blood test is called an HCV antibody test. This test tells you if your body has ever seen the HCV virus before and is positive both if you had HCV and cleared the infection on your own or if you have chronic HCV infection. The second blood test is called an HCV RNA test. This test is performed if the screening antibody test is positive. The test looks for the virus itself and tells you if you are currently infected. How should testing for HCV be approached when it comes to children? The first step in ensuring all children with HCV are diagnosed as early as possible is testing all mothers for HCV during pregnancy. Although more doctors are now testing all mothers, many children have gone undiagnosed because infection was not known in the mother and they don't have symptoms of infection early on. Any child born to a mother known to have HCV should be tested after birth. Testing can start as early as 2 months of age with the HCV RNA test. However, definitive testing should be performed at 18 months old with the HCV antibody test and HCV RNA test if the antibody test is positive. The reason the antibody test is not recommended before 18 months of age is because antibodies to the HCV virus pass from mother to child and can stay in the child's body until 18 months of age, regardless of whether there is infection. Once a child is found to have HCV infection, he or she should be monitored with periodic blood and imaging testing. These tests are performed to evaluate liver health and also determine if the infection clears on its own or becomes chronic. Children who develop chronic HCV should be treated. Fortunately, there are direct-acting antiviral drugs available that are safe and highly effective at treating HCV. They are approved in children as young as 3 years old and are easily taken by mouth with a pill or pellets that can be sprinkled in food. These antiviral therapies are most commonly taken for 8 to 12 weeks, depending on age and the specific type of HCV the child has. Side effects of the medicines can include headache, upset stomach, diarrhea, trouble sleeping, and fatigue, but children tend to tolerate the medicine better than adults. The HCV virus is able to be completely eradicated in 98% of patients who take a full course of treatment. Nowadays, there can still be a stigma against having HCV infection. It's important to know that HCV is not spread through casual contact. This includes activities such as hugging, kissing, coughing, and sharing food or utensils. While strategies should be taken to avoid blood exposure, such as avoiding sharing toothbrushes and razors, and using gloves to clean up blood, children are able to participate in all regular childhood activities and should not be restricted in school or sports. For more information on HCV, its testing and treatment, you can go to the website listed as a reference below.